I'm Dr. Moti Ramgopal. I'm a physician in the St. Lucie County area for over 20 years. I've been involved in clinical practice in all the hospitals as well as clinical research for the last 15 years in this community. So that's a great question. So when we look at vaccine safety, and this is something I've studied extensively in the last 15 years in my clinical trials clinic in Midway Road. So when we look at safety, we ask ourselves questions. Is that, okay, am I going to get sick from this vaccine? If I'm going to get sick, what is going to be the severity of the sickness or illness? So most of the vaccine effects we've seen so far related to topical areas, like the skin discomfort, pain, swelling. We haven't seen any significant or any important systemic toxicity of any of these medications. What do I mean by that? Yes, it's safe. Yes, it's easy to take. Most people who do take it have no symptoms or say they feel nothing. And then there are a few people who will say, yes, I feel discomfort, I feel a little pain or swelling or have a fever. So the vaccines are not designed like they were many, many years ago. These are new vaccine strategies. What I mean by that, these are messenger RNA vaccines, and those that have a virus-based or a virus attached to it, these viruses are not related to COVID. So these vaccines cannot give you COVID because they have no live particles within them that can elicit an infection within your body. So the vaccine side effects varies from pain, discomfort, fever, and generally sense of malaise for a few days, but all of these symptoms or side effects resolve within a few days. None of these patients will say, well, it's been going on for several weeks or months. At this time, we haven't seen any of that. So the vaccines are free, given by the health department, but if you go to CVS or pharmacies, you may have to pay an administration cost or at physicians' offices. But it's given free for everyone, so there'd be no reason why you should say, I'm not gonna take this vaccine because there's a cost attached to it. So the question about vaccines and the variants is very interesting. So when we first developed these vaccines, we weren't even aware of these variants. So these vaccines were developed against what we call the wild-type virus or the circulating virus. So we were pleasantly surprised, and I personally was very, very impressed that these vaccines do cover the variants. It was one of my significant concerns very early. What if these viruses become resistant, if they develop mutations? Are these vaccines going to be effective, and how long are they going to be effective for? So it was quite a relief to see that the data is showing that these vaccines will protect us against the variants to some extent, or to a large extent. So one of the myths is about pregnancy and fertility. So were these vaccines designed to affect that reproductive cycle? Absolutely not. There's no data, there's no evidence, there's no genetic reasoning behind that process. So when people ask that question, I look at them and said, okay, would you rather put your life at risk at this time and consider that? And at this time, there's no evidence at all to show that. Because at the end of the day, it's time for us to return to what we call normalcy. And what is normalcy? Hugging our family, playing with our grandkids or kids, traveling to go somewhere to visit a family member that you haven't seen in 6 to 9 months. The Facebook and the FaceTime and the Zoom meetings, it should come to an end soon because that's not human connection. As humans, we live for that human need, the human need of comfort, the human need of reaching out to people. But what has COVID done as well is recognize that there's a challenge in our health, in our system, whereby are we healthy enough? Who are the people who get COVID? Looking back at last year, and I look at patients coming into the hospital, and I say to myself, okay, this person is high risk, or this person is going to progress to severe illness. Who are those people? Elderly, Hispanic patients, African American community, obesity, diabetes. So there's a genetic component to response to COVID, there's a metabolic component to response to COVID, and especially with kidney disease. Almost every single person who I've seen with kidney disease with COVID, I've had a very difficult hospital course. So if you have kidney disease, if you're overweight, if you're diabetic, if you have any of these risk factors, I again advise you, strongly tell you go and get your vaccine.